Hello and welcome everybody. My name is Tamsin Rose, a Senior Fellow for Health at the Africa-Europe Foundation. This is the third in a series of special high-level debates in the lead-up to the Africa-Europe Summit, which will be held in a few weeks. And what we wanted to do with our conversations was to take issues where there are challenges and difficulties in the relationship between the two continents and have an open and a frank conversation to see what we can explore together. And this, as I said, is the third in the series of debates. Previous events have looked at the energy transition for Africa and looked at the issue of migration and mobility. Today, we're going to be looking at the vaccine challenge. And just as a reminder, we are 2 years into a pandemic, but it is far from over. Just to share a few facts and figures, just 10 weeks ago, the Omicron variant was identified thanks to the surveillance and genetic sequencing capacity in Africa. And in those 10 weeks, 90 million new cases have been identified and confirmed. This is the fastest spreading rate at any time during the pandemic. So it's far from over, and it's an issue we need to explore. Just to explain how this afternoon is going to work, you may engage with us through the chat, and we look forward to reading your comments and your messages. Please use the hashtags if you're using social media of Talking Africa Europe and Reimagine Africa Europe. There is also translation available, and you should see at the bottom of your screen in the menu an option to choose French language or English, and that will allow a larger audience to participate. So, when we look at this perspective of the pandemic, which affects everyone, but there's a different impact in different countries, we wanted to explore where we are, what's happened now in terms of the epidemiology situation, the vaccine rollout, and then we're going to be discussing where do we go from here. And we're going to be looking at how the African manufacturing capacity and the sovereignty in medical supplies can be explored. So that's how we're going to be working, and our conversation will take an hour and a half. And to get us started and to introduce the debate, I'm delighted to introduce Chrysoula Zacharopoulou, who's a medical doctor, a member of the European Parliament, a rapporteur for the Africa-EU strategy, and for us at the Africa-Europe Foundation, she's the co-chair of our strategy groups and the co-chair of the COVAX Shareholders Council. Chrysoula, the floor is yours to introduce our debate today.
Hello, thank you, Tamsin. Dear friends, as Tamsin said, I'm speaking to you today as co-chair of the African-Europe Foundation strategy groups. But as you said, I'm a doctor who has been on both sides. I faced the crisis in my hospital in Paris, and I participate in the launch of vaccination campaign in Africa. So we choose to talk about vaccine equity today. We have been living with COVID for 2 years, so it is time to have this frank and open discussion and to see the impact of the crisis on the relationship between our continents. There are tension, criticism, and controversies that need to be clarified. We are very honored to have among us today high-level political figures and experts. I would like to thank them for their contribution to our discussion. But first, let me share some preliminary thoughts with you. The global response to the pandemic has, of course, not been perfect, nor has it been perfect within European borders. Let us make the most complete and honest assessment possible. Whether it is the vaccine supply difficulties faced by COVAX, the obstacles to the rollout of vaccines on the field, the question of intellectual property, technology transfers, and the development of vaccine production capacities in Africa. It must be said, this is an unprecedented crisis. Yet Europe is at Africa's side at every stage, from the urgency of vaccination to building the continent's health sovereignty. At the beginning of the crisis, Europeans have impulsed the creation of ACTA and COVAX and structured the global solidarity response. Our objective was to respond in a collective and united way to the crisis with a particular focus on Africa's needs. Europeans did that while vaccinating their own population, despite our million people who lost their life because of the COVID, and the collapse of the European health system. We must recognize and correct what went wrong, but we must also acknowledge this reality. We must now look to the future and move forward together. Let us not let this crisis divide us, Africans and Europeans. On the contrary, let us learn from it. Let's take advantage of this Africa-Europe summit that we will have in 10 days to launch a strengthened partnership on health, and comprehensive partnership that range from strengthening health system to local production, from scientific cooperation to crisis preparedness, from regulatory cooperation to training of health professionals. Africa has shown a great capacity to find solutions to the crisis. Europeans support it, and they want to do more to support African solution in the field of health. Dear friends, thank you for your presence today, and thanks to the African Europe Foundation for allowing us to reflect on how to further strengthen our cooperation in the field of health.
Thank you very much, Chrysula, for again giving us some perspective and context. And as you say, this is a global challenge that has required all of us in all continents to rise to it and do things differently, because we've never faced anything of this magnitude before. Let me invite our next speaker, and that's the European Commissioner for International Partnerships, Mrs. Jutta Urpilainen, to give us a little more about the perspective and particularly the link to the forthcoming African Union EU Summit, which is the first time it's been held in a couple of years, so we've got many expectations for it, which will be linked to a high-level business forum where the Africa Europe Foundation is a partner in the activities. Commissioner, the floor is yours.
Thank you very much, dear friends. Since COVID-19 emerged, our two continents have faced no shortage of challenges. When it comes to infectious diseases, none of us is safe until all of us are safe. And this fact actually guided the EU when we co-founded COVAX, the global vaccine sharing mechanism with the WHO. It guided us when we began exporting one vaccine abroad for every vaccine produced at home. So over 1.45 billion vaccines exported so far. But it also guided us when we contributed 46 billion euros to help 130 countries cope with the pandemic. And 10 billion has gone to Africa. So now let's look to the future. We have committed, so the European Union has committed to share at least 700 million doses by mid-2022. So far, around half of the vaccines we donated have reached Africa. But we know also that donating vaccines is one thing, and ensuring that they really make it into people's arm is another thing. True equity demands also more than donations. So in Kigali, African ministers shared a vision of robust healthcare systems and pharmaceutical capabilities. The EU wants to partner with Africa to make that future a reality. And I have to tell you that work has already begun. So in the short term, we will continue to support the urgent response to COVID-19 initiative, including the deployment of vaccines. We have launched a 100 million euros initiative to support vaccine deployment in Africa. But we will also present a dedicated vaccination support package, which will notably have a tailored approach to roll out at country level. The African Vaccine Acquisition Trust is a clear step forward and towards Africa's strategic autonomy on health that we are pleased to support. And of course, one of the most important components of health resilience is the ability to manufacture vaccines and medicines. And this is why, dear friends, the EU launched an initiative to support Africa's local pharmaceutical production goals with a particular attention to vaccines. This will support the partnerships for African vaccine manufacturing and will be funded with at least 1 billion euros from Team Europe. Today, projects are underway in Rwanda, Senegal, South Africa, and Ghana. The EU is also supporting the African Medicines Agency and a favorable regulatory environment at the continental level. We hope to develop more hubs in more countries, and of course, we will contribute to the WHO's mRNA technology transfer hub in South Africa. So colleagues, then to my last point. The EU-Africa Summit is approaching, like Chrysoula was already explaining, and I truly, truly hope to break a new ground. Today, our focus is vaccine equity and health systems, but this is just a start. Africa is slowly starting to recover from its first recession in 25 years. The EU has rallied the international community to reallocate special drawing rights. With the pledges made so far, African countries will receive approximately 33 billion US dollars. The EU and our member states have also pledged 13 billion US dollars towards the G20's Fund for Vulnerable Countries, including Africa. So there is a lot to work ahead of us, but I would say that we have already started to work jointly towards this new approach. And I would really like to thank the Africa Europe Foundation for organizing this debate, because only together, dear friends, we can find solutions that are sustainable, but also inclusive and long-standing for both of our continents. Thank you very much for giving me this opportunity to intervene.
Thank you very much, Commissioner, for sharing your thoughts and perspectives, and again, making the link between the political journey that both continents are going to be going on with this perspective of increasing their strategic autonomy in medical supplies and medical support services. Now we're going to explore just a little bit on the current state of play of the pandemic in Africa, and I'm delighted to introduce Dr. Matsushita Moeti, who is the WHO Regional Director for Africa. And she's going to give us some perspective 2 years in. Where are we in terms of COVID-19 in Africa and the vaccination campaign? We're sharing a few statistics with you here on the slide. Dr. Moeti, the floor is yours. Please go ahead.
Thank you. Thank you very much indeed. And I'd like to thank the Africa and Europe Partnership for having invited me to come to this very important discussion. I'd like to greet everyone. I see Dr. Mo Ibrahim is online, and greet Dr. Zakarapulu, Commissioner Urpilainen, and very much greet my fellow panelists and speakers and all the people who have joined, and you, Madam Moderator. Greetings to everyone. It's a great honor to be among you and to talk about the current epidemiological status, so what has happened in Africa with regard to this pandemic. And I'd also like to mention what we've learned from previous very serious outbreaks and what it might offer as ideas going forward at this very crucial moment as we are contemplating and indeed acting on not only the principles of solidarity, equity, and inclusiveness, but trying to make them translate in order to ensure that we are all in the same place in terms of vulnerability and access to the key tools needed for this pandemic. So where are we today? We have cumulatively up to now 11 million or so people have been at least documented or reported to have been infected by COVID-19 on the African continent, with almost 250,000 people having been reported as having died. And we acknowledge very much that the level of testing and the surveillance system status in our region clearly makes us believe that there is some underestimation of the situation. The continent has gone through 3 major waves and is now at the tail end of the 4th wave, and accounts, as you've said in your data, for nearly 3% of global cases and 4% of those who are recorded to have died. The 4th wave is declining, and over the last week, all the subregions, so north, east, southern, and west and central, have reported fewer new cases. But we've seen that in North Africa, the decrease is the least at 7%, while in West and Central Africa, we saw significant declines over the past few weeks of 62 and even 64%. So we've been through several waves. And we've seen, of course, Africa consists of 54 countries. They're not uniform, and different dynamics have happened for different reasons in different countries since the start of the pandemic. Death rates have also declined, but again, not uniformly. North Africa having reported a 25% increase in new weekly deaths, while overall we have seen these decline. Overall, what we call the case fatality ratio, meaning the number of deaths over the cases that have occurred, has been significantly low in this 4th wave at less than 1% or 0.7%. And previously, it has been at around 2.5%. Again, acknowledging that perhaps our death notification and death reporting might be underestimating. But I tell my colleagues all the time that, a death is such a significant event in our African communities. I really don't think that we have hundreds of thousands of African people dying undetected in some way or other. One of the impacts I'd like to emphasize very much is the indirect impact on the capacity of our health services to deliver essential functions while at the same time dealing with the COVID-19 pandemic. That has been a significant challenge, and we've seen access to essential health services for HIV, for tuberculosis, child vaccinations, access to family planning, and even safe deliveries for women significantly declined, particularly in the early phases of the pandemic. Countries have made a lot of effort now to recover, to adjust the way of delivering services to make sure that we do not have, or we minimize and limit the deaths that will occur, not associated directly with the infection of COVID-19, but due to the fact that our health systems have not been able to sustain access to services. It's already been said that the economic impact has been extremely serious, and our impression is that as we count the number of cases and deaths and seem to be a continent not as severely affected as others, we need to keep in mind the fragility of the economies in our countries, the fact that most people work in the informal sector, and at the household level and even at the national level, the economic impact has been severe, and it will again translate into impact on health and development going forward. So this is the background that I believe needs to be taken into account as we contemplate and we have the opportunity to reflect in this partnership between Europe and Africa, how to go forward in supporting the various components that have arisen. We are a continent that has experienced many major outbreaks, including a very severe Ebola outbreak in West Africa several years ago. And another point I'd like to make, in a sense, in relation to challenges in equity, in access to key tools, is to remind us, and I happen to be somebody who's worked a lot in HIV/AIDS in the past, that we were here in relation to access to antiretrovirals some years ago, with millions of African people not being able to access treatment and dying every year. And some work was done to overcome that. We had concerns, as I say, after the Ebola outbreak in West Africa, where a global movement on global health security. There was a global health security initiative that was established as a response to that big challenge. What we need to learn as a lesson is how to work on investing and demonstrating this equity and solidarity in peacetime, not when we're in the middle of a pandemic. Much of what is happening today in terms of investment and support, which is deeply appreciated, is happening in the context of a crisis. And what we hope is that the next crisis will find these investments, the solidarity having been sustained, so that it finds Africa in a better situation, not only in relation to access to vaccines, but also being more resilient with our health systems, being more robust to be able to contain the impact in terms of that outbreak and the impact on delivery of services and lives. So as far as vaccines are concerned, I know that somebody else is going to speak about this. We are very encouraged by the current increasing availability of vaccine doses in Africa, and recognize that our continent will need to increase sixfold the number of people being vaccinated each week, which is a massive undertaking that we collectively have to support in countries. So it will be very interesting to see how we do that on an emergency basis now, how we link that with improving the health systems of our countries to be more robust, and how we take that into the future for the type of resilience that African leaders at the political level have been not only talking about, but have been translating into action with the support of partners like the European Union. So I'd like to stop there just to say that I look forward very much to our conversation. We appreciate the partnership. We are on the ground as WHO with our colleagues and partners, the Africa CDC, the African Union, the UN agencies, to support the uptake of vaccines, even as we support the strengthening of health systems into the future to be more robust. Thank you very much.
Thank you very much, Dr. Moeti. And I think you gave us a clear message to make sure that you need to make sure that the investment is sustained beyond the current emergency, so that we have the capacity both to deliver healthcare and services in everyday times as well as extraordinary times. So thank you for sharing that. Our next slot on the agenda, we're going to hear from the African Centre for Disease Control. And I apologise that John Nkengasong was going to speak, but he's been called, obviously, to an urgent meeting. He's written an excellent article that is in Nature magazine in the last few weeks, highlighting the lessons of the last 2 years on the pandemic. And the African Union is holding its own summit this week, and the African Centre for Disease Control is holding an event that people can watch live with 5 heads of state on Saturday afternoon, precisely to explore the issue of vaccination on the continent of Africa. So I encourage everyone to follow that and be part of it. But we're delighted that Dr. Radji, who is the head of the Africa CDC Public Health Institute and Research Division, is able to join us to represent Dr. Nkengasong. Can I invite you, Dr. Radji, to give us a short overview, succinct summary of where we are now, and particularly make the highlight of what we need to put in place to make sure that the African continent is ready for the next wave and to have a more resilient health system for the future. Dr. Radji, go ahead.
Thank you so much. Let me first and foremost, tender John's apology. As you know, the AU summit is currently ongoing. And today is the day 2 of the Executive Council, that's the Ministers of Foreign Affairs. So as currently is there now, he couldn't pull out to come and attend to this particular event. And let me also acknowledge Dr. Moeti, my boss. Thank you for setting the tone and the stage for this particular discussion. And Dr. Mo, let me acknowledge you as well, Your Excellency. Good to see you and other panelists. So distinguished colleagues, ladies and gentlemen, in terms of what we need to do going forward, Africa CDC has learned a couple of lessons, as you rightly mentioned, Madam Moderator. We've learned the importance of political support, which has really helped Africa to coordinate our response to the COVID-19 pandemic. Importance of working with different partners, including our WHO, who have worked closely together since the onset of this pandemic, has also been very key to the success story of Africa. We've learned a lot of things as far as the workforce space is concerned, pathogen genomics, capacity building, locally contextualized guideline, local manufacturing capacity. So these are all couple of things, couple of lessons we've learned as far as this COVID-19 pandemic is concerned. And on the issue of vaccine, even before the first vaccine was actually approved, we knew that most likely Africa will be at the end of the queue. We also knew that most likely Africa will be left with what will trickle down when everybody has taken their own fair share. And then when you go back to the nature again, you will see that John and myself plus some other colleagues did put out a write-up there just to preempt what will happen and to make sure that as a continent, we are prepared to complement whatever that come true. And it was in that regard that we did put in place a COVID-19 vaccine development and access strategy. And today we actually proved right, because that strategy has allowed us to be able to complement what we've gotten from COVAX, and has able to allow us to move, in an equitable manner as far as COVID-19 vaccination is concerned. As we know, most of our member states actually have very weak health system. Most of them are not in a position to procure most of these vaccines themselves. But with the COVID-19 vaccine development and access strategy, we have been able to support most of our member states. Now, going forward, as far as vaccine and the health system in general is concerned, Africa CDC has launched a couple of initiatives. For instance, we've launched the Saving Life and Livelihood Program, which is partnerships to accelerate COVID-19 vaccine on the continent. And this particular partnership arrangement is underpinned by 4 key pillars, which is 1, to support the procurement of vaccines, support the deployment of vaccine within our member states, irrespective of the source of these vaccines. And of course, number 3 there is to support the partnership for vaccine manufacturing on the continent. And the last but not the least, to continue to strengthen our health systems on the continent. And today, that particular initiative, that particular program has a budget envelope of 1.5 billion USD. And we believe with that particular funding, we'll be able to create that ripple effect that will draw support from elsewhere, including from the EU. Let me acknowledge that EU has actually played a lot of a role as far as COVID-19 response on the continent is concerned. In addition to the Saving Life and Livelihood Program, we have also launched what we call a new public health order, which has enjoyed a lot of political support. And that new public health order, for us, we believe, is what will allow our member state to build back better, stronger, and bolder from this COVID-19 pandemic. And in that particular regard, we have enjoyed the support of the political leadership on the continent at the highest level. As you all are aware, we have our COVID-19 commission under the chairmanship of President Cyril Ramaphosa. And over the weekend, Saturday and Sunday, the head of state will be meeting. And one of the key highlights of that meeting is that comprehensive report from President Cyril Ramaphosa, which will highlight most of what we need to do going forward. But just for the sake of this meeting, let me say that under the new public health order, we are looking at 1, how do we continue to strengthen the health institutions on the continent? And the President Ramaphosa will speak to that. Number 2, how do we build a kind of adaptive human resources for health, that will allow us to bridge the gap in terms of field epidemiology training program, in terms of community health workers, in terms of our nurses. Number 3, how do we build local manufacturing capacity for air security commodities, like vaccines, like therapeutics, like diagnostics? Of course, we have all seen what has played out as far as this pandemic is concerned. And last but not the least, which actually key into what we are discussing here today, is that of respected, action-oriented partnership. You know, how do we ensure that we have that in place going forward? You know, sort of partnership arrangement that we see our membership priority as a top priority and not what is imported from elsewhere. So, Mr. or Madam Moderator, let me stop at this particular junction to thank the organizers of this important debate that Africa CDC, we are really, really proud to be part of this, and we look forward to the outcome of this particular debate. Thank you, and over to you.
Thank you very much, Dr. Ravi, and I particularly welcome your focus on the importance of addressing the gap in healthcare workers. That's something that we at the Foundation have also identified through our health strategy group, and we're currently developing a proposal for an observatory for future health workforce needs, because this is a challenge also in Europe. We have gaps and needs in our healthcare workforce. So this is an area where I'm sure we can work with you together. I'm going to bring in briefly from the floor Pascal Lamy, who is a member of the trustees of the Friends of Europe and also from the Paris Peace Forum. Would you like to make a contribution?
Thanks very much. I have two questions of a more political nature at this stage. Number one, I remember talking to many of my African friends let's say last summer. And what I got from these conversations was a very strong anti-European feeling, sort of deception. We've been talking about a partnership between Africa and Europe, and you are letting us down. Has this changed? Have the developments, for the last half year, what we heard about the preparation of this EU-Africa summit from Commissioner Upilainen, on the African side, has this changed or not? And my second question is a more technical nature. If we look at the bottlenecks that so far have prevented a normal, fair rate of vaccination on the African continent, what would be today's, not last year, today's proportion of vaccine availability, vaccine affordability, vaccine accessibility? And we know that we've had serious challenges in many of this sort of chain, from production to a jab in one arm. What would be, according to the experts in this conversation, what would be the biggest problem today?
Thank you very much. And clearly some key questions that we would need to ask. Dr. Ravi, maybe I could invite you to reflect a little bit on how the perception in Africa has changed. 6 months ago, or last summer, it was clear that there was disappointment. Things were not getting through. You've now mentioned that the vaccine program is starting to roll out. So maybe you'd like to pick up to see if the relationship is feeling better. And also this issue about what would be a fair proportion on accessibility, affordability of vaccines? If we looked at it from Africa's proportion of the world's population, what would be a better arrangement? You mentioned the challenges of last year feeling like waiting for trickle down and being at the back of the queue. If we looked at things differently, and maybe this is something you might well refer us to the report, and we've put the link in the chat that was to the article written by Dr. Nkengasong, which covers many of these issues. But would you like to comment on that?
Thank you so much, and thank you for that question. Well, let me start with the so-called sentiment against the global north. Of course, there is no doubt about it that Africa felt let down, let me put it that way. Number two, we have seen nationalism playing out, as far as the COVID-19 vaccine and other medical supplies landscape is concerned. We have also seen the collapse of some of the global architecture, including some of the multilateral mechanism, So, and the record is there for all of us to see. Now, in terms of numbers, today we are looking at between 1.2 to 1.3 billion people on the continent of Africa. So, meaning that to get to that WHO target of 70% COVID-19 vaccine coverage, we need to immunize around 900 million people. We know that through COVAX, we have something close to 350 million coming through. Through the AVAT mechanism on the continent of Africa, we have around 400 million. So I think in terms of supply, we are not doing badly. But from supply, because of what is the vaccine that does not get into people's arms. So the greatest challenge is the delivery, last mile delivery on one hand, then two, creating the necessary demand for people to take those shots. So these are some of the challenges. And the Saving Life and Livelihoods, we try to address some of these challenges, but that program cannot do it alone. So we need the support and everybody. We know that a lot of support has been announced, but in practical terms, how many and how much of this support have we seen on the ground? I think that is some of the issues. So today, through this some of this program, we have aligned some key activities that need to happen for that 70% coverage to take place. So and I think the documents are there for all of us to see. Then, in terms of vaccine perception, late 2020, before that's from August to December 2020, the Africa CDC, together with London School of Hygiene and Tropical Medicine, carry out a multinational survey. And in that survey, 4 out of 5 Africans were actually ready, to take the shot. And the 20% or so, that has issues with taking this vaccine actually needed more information. They are not necessarily anti-vaxxers. There are people that need additional information. So we need those sort of experts, that will be able to create this sort of demand on the continent. And that same survey or similar survey was repeated some 2-3 months ago. That has not changed. Quite a lot of our people are still ready, to take the vaccine. So as I mentioned, we need support in terms of last mile delivery, and we also need support in terms of getting those shots into people's arms. Over to you, Madam Moderator.
Thank you very much. And I note that you picked up on the issue of vaccine hesitancy, which was mentioned a few times in the chat. I'm keeping an eye on what people are mentioning there. Commissioner Appilainen, can I invite you to come in and also comment on just the relationship between the two continents and how we're moving forward, what we're improving, and how we've got this, we can focus particularly on what we just heard, the last mile delivery, which is the logistics, the supply, the healthcare workers, making sure the infrastructure is there to actually use the doses as they arrive.
Yeah, I thought that maybe I would answer to Pascal and also, express a little bit how I see the situation and what is the feedback I receive from Africa. Of course, if the general vaccination rate is still below 10% in Africa, so we have to admit that the whole international community has, in a way, failed because we haven't done enough for Africa. That's the fact. But then when it comes to partnership between the European Union and Africa, we have done, I think the partnership is very strong. And good example of that is that the European Union has done much more than the other international players when it comes to donations, but also when it comes to financial support to Africa, and when it comes to this new initiative relating to vaccine manufacturing in Africa. We have been leading this international approach, and I think it's a good example of our commitment to this partnership, which we still want to strengthen also in the summit in 10 days. But I fully agree with both of the doctors because what we need to do now is, of course, to share more doses to Africa, but also to focus on deployment side. And this was also my messages in my intervention. And that's why the European Union has actually worked together with our African partners on the ground in order to identify and define those countries where the vaccination rate is lowest in order to give additional support to them. And this is exactly what we try to do now through this vaccination support package, which we are preparing here in the Commission. And the idea is that we can still launch this package ahead of the summit so that we can give an extra additional support for the deployment and also to strengthen the healthcare system in these most fragile and vulnerable countries. So we have done a lot, but of course we need to do more.
Great, thank you very much. Now I'd like to invite Ashley Furlong, a journalist for Politico, who would also like to ask a question. Ashley, would you like to go ahead and unmute yourself?
Thank you. Those are fascinating interventions. A question for Dr. Raji Tajuddin. You mentioned hesitancy. Do you think the delayed sharing of vaccines, for example, from European countries, has affected hesitancy on the continent at all? Is there any sense that the public in African countries feel that they're getting sort of vaccines that Europe didn't want, for example, those with short shelf life? And a question for Dr. Moeti. You said how cases are going down on the continent, but vaccination rates are still very low in many countries. How concerned are you that this leaves some regions at risk of becoming breeding grounds for the next highly transmissible variant? Thank you.
Thank you very much. Can I invite Dr. Raji to answer the first part?
No, thank you, Madam Moderator. So the first question on whether the delay arrival of a vaccine, well, I think it's also it's part of it. The hesitancy we are seeing is actually multifactorial. But the underpinning factor here is that of lack of adequate information. And we believe that with adequate information, you will discover that surely uptake will increase. And this has been demonstrated as part of our Saving Life and Livelihood program. For the ongoing African Cup of Nations, Africa CDC is currently providing a lot of support in there as far as COVID-19 vaccination is concerned. What we have seen is wherever we deploy risk communication and community engagement, you see massive turnout of people, coming out to present themselves for those shots. So because during the risk communication and community engagement, you're able to address some of their concerns. So meaning that we need more experts to be able to go into that risk communication and community engagement to create the necessary demand for some of these vaccines. On the second part of whether, that perception that rejected vaccines from Europe. Well, I think to some extent, and let me put that into context. You will know that some couple of months back, a lot of our member states did complain that most of the vaccines that are coming onto the continent are vaccines that are close to expiry, and because of inadequate logistics on the continent, there is no way we can deploy those vaccines before they get expired. And when they get expired, the blame is on the member states. And that led to Africa CDC, African Union, WHO, and Gavi to issue a statement on that henceforth, Africa will not accept any vaccine that is close to expiry, because it's of no use to us. Before you deploy those vaccines, they already expired, and the blame is like Red Center. You have vaccines, but you are not giving those shots. So I think the simple answer to your questions, yes, those 2 points you mentioned are actually contributing factors. Over to you, Chair.
Thank you very much. Dr. Moeti, can I invite you to respond on the question about the fact that there is still ongoing transmission and some parts of Africa have very low levels of vaccination? Does this create a concern about creating a future space for new variants of concern to emerge?
Yes. If you permit, if I can just say a word on the vaccine hesitancy issue and if you like, the interaction between Africa and Europe. One of the things that we observed, the history between Europe and Africa is as it is. and the relationship between the peoples has these elements of a past colonial history and African people that perceive themselves to be treated, looked at in certain ways. One of the biggest drivers of African rage against vaccines was some remarks made by a couple of scientists who talked about, oh, we can go to that clear field and just do some experimentation. It triggered such a strong reaction and a sense of mistrust of the vaccines that this lingers even up to today. I think when you're talking to communities, this emerges. We're used to being used as guinea pigs. So how to address this in the respectful partnership, in the relationships, in the discussions by people at all levels is one of the challenges, frankly, that we need to confront honestly and work on doing something about. So that perception of that old history hanging on in the relationships today in an understated way, in a hidden way, are still there. And I think we need to show that this is no longer the case. So for example, when people see booster doses for children, while very high proportions of most vulnerable are not vaccinated, that raises, even if the vaccines are becoming more available, I think all the narrative as well as the actions around this in this context really needs a lot of attention. Yes, I do agree that the risk of variants emerging with, despite the fact that number of cases is going down, we've had waves of, the last wave driven very dramatically by the Omicron variant, which fortunately was not as lethal as previous variants. But with the state of low level of vaccination of the population, the high rates of transmission that may go on when a more transmissible variant comes along, the emergence of variants is always there. We are hearing, of course, now around purposely developing vaccines to deal with variants. We hope that this will be going along with ensuring that those people in Africa who haven't had their first vaccine have access to the vaccines, including, I agree very much with Dr. Taj, the support to the operation of delivering these vaccines, which will need to be really strong. I mean, we've studied in WHO 20 of the countries that are performing the worst and know the factors that are driving this delay in delivering vaccines is to do with financing, is to do with capacity at the peripheral level, and is to do with actually existing problems in terms of the salaries of healthcare workers. We need to look at all that, I believe, in designing the support that's coming on board to roll out the vaccines. Thank you.
Thank you very much, Dr. Moeti. And we are indeed, later on in our conversation, going to be picking up on these issues of, how domestic manufacturing of vaccines in Africa can be developed, which creates a more reliable and accessible supply of vaccines and therapeutics that would be useful. But just before we move to our next section, I'd like to invite Mo Ibrahim to take the floor. He's the chair and co-founder of the Mo Ibrahim Foundation and, of course, one of our key partners in the Africa-Europe Foundation. Mo, the floor is yours.
Thank you. First, on behalf of the Africa-Europe Foundation, I really thank our panelists. Wonderful contribution. But I also thank my friend Pascal Lamy for injecting really some energy into the discussion, because our panelists have been wonderful, but they have been polite, I think. One of the things we do in our foundation discussion is we really need to be frank. So let me just make a few comments. First, in the issue of hesitancy, I think this is a global phenomenon. It's not an African phenomenon. You look at the number of people in Austria who refuse to take vaccines, in Switzerland, in the United States, is the same. So this is something to do with us as human beings and information and disinformation, etc. There's nothing African about hesitancy. This is one point. Why Africans have been upset with Europe, as Pascal said, which is true. All Africans are upset with Europe. We have to accept that and say it honestly. Early in 2019, at the beginning of the foundation, there was this major statement by 30 leaders, European prime ministers and African prime ministers. There were 30 leaders published a huge, I think they all saw it in the Financial Times. and elsewhere. And they said clearly, nobody is safe until everybody is safe. They coined that phrase actually, which every leader after that used it. They called for immediate 100 billion support for African economy. That was 2 years ago. And nothing happened. So the lack of support, of lack of action, is not because the leaders did not know what should be done. I think we need to appreciate probably a little bit the political reality. We are talking about politicians at the end. Politicians, unfortunately, main focus is re-election. And you get re-elected if you vaccinated large amount of your own people. And that was everybody is bragging about, every leader. You look at Boris Johnson, at anybody, they're just bragging about how many people they managed to vaccinate, and that's why they should really win the next election. So I think that is the elephant in the room. Politicians' main purpose in life is survival. And we have to accept this is political realities. Our life, we're going to be just kidding ourselves. Those leaders know what should be done morally. They know if it's a disease circulate elsewhere, it's going to come back to haunt their own people. They know that. They know all the facts. We don't need to lecture them. But that is what's happening, and we have to accept that. Africans also were disappointed with the pharmaceutical industry because it was not a question of money. There is a number of entities created and given money to go and buy vaccines for Africa. All the stories I hear, you try to go to a pharmaceutical company, here's my money, cash. Mm-hmm. You have to go to the back line because big customers come first.
Yes.
COVAX people were saying, we don't know when we're going to receive our next. Canada knows when the next batch of vaccines are arriving, then they can prepare to distribute it. Africa doesn't know because nobody knows when we receive what we received. And
you make a good point about reliability.
Just the issue of the IPR. We were all disappointed also how Europe moved to protect its own pharmaceutical industry, and the rules in the WTO is clear. In emergency, that can be done. Did we save any major or such urgent emergency since the Second World War? None. Why aren't we do it? That was a question. But not all the blame should be really on Europe. This is all the rich countries behave like that, whether China, everybody. So we upset with Europe because maybe we think Europe is closer to us. But on the other hand, we have also to admit that we Africans also made mistakes. We need also self-criticism. Our health systems are weak. We spend 1.9% of our GDP in our health systems. The average worldwide is 5.9. So here is a problem. Our data collection is very weak. We don't know. Half our kids are not registered, no birth certificate for them. This registration is weak. Data is very important to manage the daily life, to manage policy, let alone pandemics. We need to strengthen our statistical offices. There's some stuff also we need to do us ourselves as Africans in order really, before we start blaming other people. So I think that we need just to have this kind of balanced discussion. Sorry, I've taken too much time, but I felt I should say some stuff here. Thank you.
Thank you very much. And we still have an amazing range of speakers who are going to share their expertise, particularly in some of these challenges around the practical aspects of delivery, the infrastructure, the cold chain, and how to do this. Jutta, can I invite you to come back very briefly before we need to move to our next speaker? Go ahead.
Thanks a lot. I'm looking forward to really, continuing my discussion with my friend Mo Ibrahim, because of course you were also very provocative. But I have to defend a bit, politicians, because we have to also admit that it's their obligation to take care of their citizens. That's the obligation of the leader of the country. And so, of course, that's what the European leaders have been doing, taking care of their own citizens. But I also want to underline that in addition to that, from the beginning of the crisis, the European Union really have shown solidarity to Africa, but also to other partner countries around the world. And I cannot agree with you that there is a lack of action, because if I only look at the facts, 46 billion euros support to our partner countries, and most of that to Africa. If I only look at the vaccines, 400 million vaccine doses have been shared by our member states. If I only look at the 1 billion euros initiative related to vaccine manufacturing in Africa, if I only look at the 100 million euros support package to deployment, of course, this is not enough. And here we can agree. But we have done a lot. And like I said before, European Union really have shown the leadership. If we really compare our efforts and activities to other international players, the US, China, Russia, and other countries, our efforts really are the biggest ones. So I understand that Africa's citizens are disappointed. I fully agree that we have not done enough as an international community, but on the other hand, I need to a little bit also defend and protect all the efforts the European Union countries, the member states, but the Commission itself has also done.
Very much, Commissioner. And now we're going to move into the next section. We're going to explore some of the practical aspects of getting the delivery of the vaccinations actually physically into people's arms. And then we're going to start reflecting on what it means to support this African political commitment to domestic manufacturing, what kind of investments are needed, the issue of international property. And we'll also be talking to some of the people from the pharmaceutical and the vaccine manufacturing, so we'll get a sense of what their plans are to develop this capacity in Africa. But just to launch us off, I'd like to invite Abika Soya, a policy consultant and at the Office of the African Development Bank, to ask a question to frame our next conversation. Abika.
Good evening,
Hello. Sorry, we've got a problem with your connection. Can you put your question in the chat so I can see it?
Yes.
That's great, Abika. Apologies, technology is not our friend at times. If you can put your question in the chat, that will be useful. And just so that I can, let me introduce the next people who are going to speak so you've all got a sense. We have Abubakar Campo, who's the Director for Health Programs for UNICEF, who'll be sharing some of the perspectives particularly, and they've been involved in actually delivering the vaccination campaign in Africa. We have Mark Sprenger, who's the Global Health Envoy for the Government of the Netherlands. We have Professor Jeffrey Lazarus, who is a co-director of the Viral and Bacterial Infections Program at the Barcelona Institute of Global Health. And we have Dr. Solomon Zodu, who is the Deputy Director for Africa of the Bill and Melinda Gates Foundation. So we have an extraordinary panel of people who have expertise on the ground in this last mile issue and who are also able to give us some perspective about where we go from here. And I'm waiting to see if we can get our question. But if not, let me start by Abubakar Campo. Just give us a sense of what the vaccination campaign has been like. This pandemic is unprecedented, but not unpredicted. In 2018, the WHO talked about disease X, and we knew that there was something coming. With this pandemic, the vaccination campaign is the largest logistical campaign or program ever undertaken at global level. So, of course, we expect there to be challenges along the ground. So what can you share with us in terms of the practical realities of getting the vaccination out and into arms across Africa?
Thank you for the question. Thank you for inviting me. I think some of the challenges have already been mentioned by Dr. Mweti and by Dr. Taj, and as well as by Mo Ibrahim. I think, the making sure that the vaccines, so that we can basically determine when the vaccines are arriving in countries, has been an issue. I think really reliability of when and how much the expiration date of those vaccines, as Dr. Tasha has mentioned, many African countries have been pushed back, but it's not just the expiration date. It is also when donations are given. They're not given with syringes, they're not given with diluents. These are all kind of challenges which are there. But the two big challenges, and I think Dr. Tasha alluded to them as well, is really with the increased numbers of vaccines arriving into the countries right now, we need more human resource capacity. We have already mentioned that in many of the African countries, the health systems have been very weak. And one of the key elements is the human resource for health. So having a surge of those human resources to actually do the immunization campaigns or immunization activities has been a challenge. It is not that Africa doesn't know how to do immunization campaigns. I think we have been doing vaccinations for years. We have been involved in the polio programs, in measles, but in all those campaigns, money is usually upfront in the country, the plants are ready, and the vaccines are sufficiently in supply. So it's easy to implement. Here with COVID-19, we have challenges with all of these traits. Funding is not necessarily in place to put in place the teams for vaccinations. You have the vaccines, the reliability of what quantities is not always determined. And then we have the vaccine hesitancy, which everyone has been speaking. And I think the vaccine hesitancy is a multiple factors. I think we can't just say it's about the issues of what has been happening in Europe and so forth. It is also confidence, of believing in health systems in itself by the communities themselves. If you have weak health systems, it doesn't inspire a community of trusting the service provider in itself as well. So therefore, an investment in health systems is critical, not just to respond to this pandemic, but also for future pandemic. But we have good examples because we had from the European Union, and in particular from the French government, additional resources, and we have basically implemented in two countries, which are Benin and Sierra Leone, which had very low immunization coverages at the beginning, plagued by those factors which I have mentioned. But when money came into place, money was pre-positioned, we had much more reliability of vaccines coming into those countries. Yes, I will accept that these are smaller countries where the quantities of vaccines doesn't necessarily, but at least they knew when those vaccines are coming, they were sufficiently with all these other accessory components. And there was money for hiring surge capacity in human resources, as well as doing the demand creation in those countries. And those two countries, which were at less than 3.5% of vaccine coverages in October, have basically increased their vaccination rates by day by tenfold. So when they were doing 1,000 vaccinations per day, with those additional funding and preparations and political will, which was also created by the resolution, they are vaccinating right now at 10, and they have reached respectively, 21 and 40% of coverage. So it is possible to increase the capacity in terms of vaccination, but for that, we need to have those fundings in place before the vaccines are arriving. We need to have the political will, and I think these can be basically achieved when we are creating this enabling environment for everyone. So there needs to be really an investment in the future on health systems, first and foremost.
Excellent. Thank you very much, and apologies that we had some challenges with the video feed, but your voice came through clearly. Mark, let me bring you in there, because we've just heard from Abu Bakr that you really need sustainable investment in health systems to make it work. And Mark, you have experience of supporting governments who try to roll out vaccination campaigns where you've got a lot of physical challenges, remote areas, rural areas. With this COVID campaign, which was such a logistical challenge, what would you like to contribute to our conversations? And I'm going to remind everyone that we're looking for just 2 or 3 minutes, very short interventions.
Yeah, thank you very much. So my comments are based on my experience as advisor for the vaccination campaign on the Dutch Caribbean islands and the Republic of Suriname. maybe you know that a large part of this population are from African descent. Now, what I have noticed is that parts of the vaccines end up in a bin, are really not used. Now, I think that's my experience, that there are 4 lessons. Now, lesson 1 is that developed countries should realize that you can provide a vaccine, but that's only half of the solution. Low resource countries often lack resources and accessible knowledge to organize an effective campaign. Rich countries should also provide expertise and financial resources that enables low resource countries to hire local people. I often see that they provide consultants, but please provide money that the countries can hire their own people. A lot of these countries don't have money to pay their own people. That's important. And of course, also to establish the cold chain. Now, the second lesson is that the poor countries need tailor-made guidelines. I have seen often that guidelines are developed by well-developed countries. They are too bureaucratic, too detailed, but, keep it simple. Keep it really efficient. It's important to vaccinate as many as possible people in a short time. Now, the third lesson is that half of the efforts should be used for communication with indigenous people, the hinterland, using their local language and really counterattack false information. One of the biggest mistakes maybe I made was to underestimate the impact of social media in the hinterland. It's really enormous. And my final lesson is that you can only motivate indigenous people if they are aware that there is a COVID health threat. Now, it's really important that you have local diagnostics and a registration. Because if there is no registration, they are not aware that there are people dying because of COVID. And that relates to good basic health system in the hinterland and really invest in health system strengthening, as also mentioned by previous speakers.
Great. Thank you very much. So again, underlining the importance of investing in health systems and connecting in to local communities. So we have both the trust and we have the health workers available and who have the relationships with the communities in order to build on that. You also mentioned the importance of cold chain storage and training. Let me bring in Professor Jeffrey Lazarus at this point to look at it from a policy and a political perspective. We've heard there some of the practical challenges, but with getting the vaccines into the arms, where do you see the big gaps that we still need to address?
Thank you very much, Chair. Mo Ibrahim said we shouldn't pull punches. I'm going to make one main point on logistics that's also related to policy. Malawi, South Sudan, Liberia, Mauritania, Gambia, Sierra Leone, Guinea, and the Democratic Republic of Congo. 450,000 vaccine doses expired in these countries due to delays in shipments of vaccine doses and therefore no time to roll out before the expiration date. So we need longer expiration dates. We also need to reduce closed vial wastage by better tracking and more timely redistribution of surplus vaccines. This requires high-income countries to improve advanced planning regarding their surplus donations and reallocations. So it's not just about the lack of vaccines that's an issue. It's also about vaccine wastage. I believe that with our technology, know-how, and desire to live long and healthy lives, that via the United Nations, the world was well positioned to address pandemic X, as you mentioned, Chair, AKA COVID-19, and I was wrong. I thought that after an initial focus on high-income countries, the world would increase production and take equity seriously, if only out of enlightened self-interest, to prevent new variants of concern, and I was wrong. I thought COVAX would work better, wrong again. And today, on the 3rd of February, we're having this debate because the world is still failing, and like it or not, that includes Europe. So if we're going to improve health outcomes, not just for Africa, but for the entire world, we have to think globally. And for those of us in Europe, we need to act locally to get our governments to work I mean, we heard already that Europe is providing hundreds of millions of vaccine doses, but we play an important role in the United Nations. We play an important role with our partner countries and high-income countries, and Europe needs to lead the way in making sure we're able to produce, get the vaccines there, and take on the very practical issue that I highlighted, given I have just 2 minutes of vaccine wastage.
Thank you. Just before I move on from you, can I just pick up on the issue that Mo Ibrahim raised, which is the issue of intellectual property? It's a particular challenge. We've started to have some movement, and I know you've worked for a number of years in the area of infectious disease. We've referred to the challenges 20 years ago for HIV, where people in the developed world, particularly in Africa, had delayed access, and this led to a huge number of deaths. What's your view on the intellectual property and the extent to which it's been a break on rolling out access to things or not?
Well, some people are postulating that it has, the patents and the IP have been one of the main issues. And I know Dr. Keeney and others will be well placed to address this. But I think the challenge is also the manufacturing. I mean, to make, an mRNA vaccine, you need there's 100 different pieces, in that manufacturing puzzle. We've had shortages, we've had supply issues. So IP and patents are one issue, but the actual manufacturing capacity is the other. And some African countries have said that they're ready, they're well positioned. We know that WHO, Gates, and others are working together to increase that capacity, but we need to increase that capacity and we need to make sure it stays there forever. I mean, we just heard today the breaking news that an HIV vaccine, albeit in a phase 1 trial with mRNA technology, is on the way. So we need to start realizing that we're going to need to produce these things in these vaccines, at least in Africa as well.
Thank you very much. Dr. Solomon Zudu, can I bring you in to pick up on this, on the challenges on the African continent of the vaccination campaign, and also we've heard they're preparing the ground, creating the resilience and the capacity to deal with future health threats and have strong health systems?
Sure. So thank you. Thanks for the organizers and for having me on and acknowledging colleagues on the call. There's a concept that I wanted to introduce because it also builds on the fact that, how do we work together as opposed to looking at how this pandemic, the vaccine introduction was actually managed. It almost feels like, and I think it played out as a relay. The appetite and the attitude was, as we can get the vaccines on the continent, they will find themselves in people's arms. And that was not the case. So we felt miserably on that. And we need to really understand the fact that have we missed an opportunity and how do we, reset and move forward to make sure that we have the right equation for the next time around? Or how do we increase the vaccinations at this point? Along those lines, there's a lot has been said, a lot of intellectual conversation has gone on. So I don't want to repeat a lot of things, but there's one thing that I want to identify when it comes to hesitancy, and I have to, and I'll answer your question, moderator, around hesitancy. What we failed to realize again and again, and I think we're going to make this mistake again in our attempt to actually vaccinate even more people, also for the next pandemic when it does happen, of not designing around the individual. We are absolutely eliminating the fact that there's a human factor there that we're not looking at. There's a socioeconomic factor that no matter how many vaccines we bring in country, unless we get rid of these barriers that continue to exist, social barriers, economic barriers, we are going to end up talking about hesitancy when it's actually a barrier-based reluctance for individuals not being able to prioritize to go and line up in a queue that is 300, 400 people long, when in the developed world, we just walk into the next CVS and we get it done in 15 minutes. That 15 minutes versus a whole day, a half a day wasted, not gaining your wage, not providing for your family is going to be something that we really have to make sure that we look at. Communication has been something that we really has come up across, and it comes even more consistently as we move forward because of also seeing the high amount of natural immunity that's coming out on the continent and the therapeutics in the background. When these things come in and they start complicating the vaccine delivery narrative, we really have to make sure that we show value for the vaccination campaign that we're putting out there. We bring the beneficiary, we bring the consumer in the conversation and the planning process. We cannot make it supply driven. It has to come at a point to become a demand driven narrative, and the best informed patient makes the best complacent, the best patient that's gonna make sure that they take their medication. So as we move forward, to your point, how do we come together to kind of really plan for the next pandemic? It's multifactorial. Bringing manufacturing closer to the problem, bringing resources closer to the problem has proven the fact that we do better when we have it close. Proximity plays a huge advantage. Knowledge transfer, being able to produce on the continent is massive. I won't go into that because I know the next panel will address that. But I just wanted to make sure that we do not forget that we're dealing with individuals that have their own socioeconomic challenge. And when we do talk about hesitancy, we need to make sure that we differentiate it from the barriers that do exist in the day-to-day activity. That's so underestimated. And unless we really design around an individual and their socioeconomic status, we won't be able to increase those numbers.
Thank you very much, Dr. Zewdu, raising these key issues, looking at the human factor and proximity. And in fact, we've had some comments in the chat that have picked up on some of that. People have mentioned the challenges of energy and electrification, particularly for rural areas, that cold chain requires reliable electricity supply, and this needs investments. And it is because it takes a much greater battery than small solar microgeneration that we're talking about. So now we're going to pick up on some of the things that we mentioned earlier, which is creating a strong manufacturing capacity in Africa, this proximity element that Dr. Zewdu talked about, making sure that there is both the factories and the skills to be able to do it and investments that would make it happen. And just to kick off this final block of our conversations, let me invite a representative of our Debating Africa platform, which brings citizens and young people together. Tanda Malanga, please go ahead and pose a question for our panel.
Thank you. Would vaccines being manufactured in Africa help address hesitancy on the continent? And if so, what kind of infrastructure would be needed for Africa to begin manufacturing its own vaccines and health products overall?
Thank you for that, Tanda. Let me just introduce to everyone the group of people who are here to help answer some of these questions. We have Marie-Paul Kieni, who is the chair of the Medicines Patent Pool. We have Morena Makowena, who's the CEO of BioVac Institute. We have Cirque Potting, who is the COO of BioNTech. And we have Abebo Aemro Selassie, who is from the IMF, responsible for the Africa desk, the director for the African department. So 4 different aspects that we can look at. We can pick up on the issue of IP, we can pick up on the issue of investment and funding, and then we can talk about some of the specific challenges in creating and building the infrastructure to manufacture high quality, safe vaccines on the continent. So Marie-Paul, let me invite you to pick up. We heard earlier about the issue that IP, some people say that this is the barrier, and others say, well, it's just one factor in a number of different issues. What would you like to say on this, and particularly make reference to the Medicines Patent Pool as a new proposal?
Thank you very much. This is a very important question indeed. Local production, domestic production on essential health products, including vaccine, is an imperative in Africa. It is imperative because this is a question of sovereignty and also a question of health security. So how can we make sure that there is local production on the African continent, and that this is not only for the last steps, for just the fill and finish, but that it is for the full production of vaccines, and also that it is not only made by affiliates of a multinational company, but this is owned by Africans and by African governments and people. So in order to make this a reality, WHO, and when I talk about WHO here, I'm talking about WHO in Geneva, but also, of course, the Africa office with Tsidi Moeti, and also the WHO representative have launched an initiative to help African countries and also countries everywhere around the world who are interested in starting a production of mRNA vaccine to get the technology. So the idea is to develop a technology that would be free of rights in low and middle income countries, and that would allow to produce not only COVID vaccine, because this is the short term, but could also produce in the future a portfolio of new vaccine, tuberculosis, HIV, to name only a few. So WHO has issued a call for expression of interest, and the group, the consortium who has been selected is a company called Afrigen in Cape Town, South Africa, and Biogen, and Morena will no doubt talk about the after me. Together with the South African MRC. So how does it work? Afrigen will develop the technology based as much as possible on technology which is available, as I said, free of IP rights. And this technology will be then transferred to multiple partners. These partners we called spokes. And the WHO Director General, Dr. Tedros, will soon announce the spokes who will receive this technology. So what is needed? What is needed is science and technology, so knowledge, and this will be provided by WHO and partners. It needs IP and contracts on know-how, and this is dealt with by the Medicines Patent Pool. And so together, we have started to work. The first batches, small scale, have already been produced in Afrigen, and we hope that this will be able to start scaling up, and that starting at the end of this year, the first clinical trial will start. So this is a very important initiative. What is needed, of course, is, as I said, infrastructure, financing, and this is provided by many European partners, but also by countries beyond Europe. And what you need also is human resources, human capital, because the biomanufacturing workforce is quite limited. So another effort has to be put to build and to train many more people to be able to operationalize these new factories. Thank you very much.
Thank you very much, Marie-Paule. Morena, let me bring you in now, because we've just heard that IP is part of a spectrum of things that you need to have a functioning system that will get manufacturing going. We've heard about the lack of expertise and the specialization that's needed. RNA, which is used for the new vaccines, is a brand new technology. There's very few people in the world who have experience of it, but we do know it's an exciting new platform that may be used for many other medications afterwards. So the investment in bringing that brand new technology to the African continent is hugely significant. What can you share with you from your perspective of both, building on the assets that already exist in Africa and what we need to invest in terms of capacity in order to take advantage of these new technologies that are coming?
Thank you, and thank you for inviting me to this very exciting panel and a very important discussion that, during the course of 2021, one was afraid that this debate of vaccine manufacturing on the continent will wane and people will get tired. And I'm hoping that we will continue talking about it, because if we don't continue talking about it, then we'll just go back to the old order. I think I'd like firstly to just, start by looking at the vaccine manufacturing landscape when we actually started vaccine manufacturing. And obviously this was many, many decades ago, that the vaccine business was a government business back in the 1930s and the 1940s. So it was not a very, let's call it a business sexy industry. It then changed over time, where governments could not sustain the innovation. And I'm talking globally now, this is not only on the African continent, but that it was private sector led, and that throughout the 70s and the 80s, a lot of changes happened, including in Europe, where a lot of the public owned vaccine institutions actually came to a halt. So where I'm going with this is that private sector is an important pillar in this landscape, and in that coming to the African continent, that it's important that whilst, we can have state-owned entities, but private sector-led initiatives is quite important for innovation and to make sure that there is, innovation that can come through, and that ultimately that the vaccine business is actually a business. And I think that is what I'd like to really emphasize with what I'm saying, and I'll come to the continent just now in terms of the challenges that we are facing. In the 90s, and I think many people around the call that are, from the WHO would know that there was a crisis in the mid-90s where a lot of countries could not get vaccines because the industry was not willing to supply, at the prices that were there. This was pre-Gavi, and a lot of that crisis, actually, that's what led to the likes of Gavi coming into being, and a lot of philanthropic organizations, including the Gates Foundation, then funding. So what I'm saying is that prior to Gavi, there was a particular order in terms of how vaccine business was, and it was not viable for the business, for the vaccine players at the time. And through the likes of Gavi and other initiatives, that essentially gave rise to, why India is such a large industry to some extent. It really was supported a lot with this, what was at the time a very new initiative called Gavi, a very innovative initiative called Gavi. Now, this was 20 years ago. Where I'm going to is that those, that we do have the potential as a global community to come up with new initiatives, okay, as I've described. And that for Africa's sustainability, that we do need to find a new mechanism that can make sure that there is sustainability on the African continent. Because the world order in terms of how it worked and the reliance that we thought that we would have has resulted in Africa being the last one to get vaccines. We've saw vaccine hoarding, the criticism of the COVAX system, which is obviously aligned to Gavi. So essentially we need a new order that, and we all have a global population have the potential to do that if we understand that ultimately vaccine manufacturing is something that needs to be sustained. Vaccine manufacturing is expensive, regardless of where you are in the world. And therefore, in Africa, those realities are. Okay. Africa does have the capability. I think that's quite important, that we say that Africa has the capability, and that capability is in various ways. Now, a lot of us have the downstream platform, including the company that I'm representing, but we also have product development, and that's where it's important that we go upstream and that we have the ability to absorb technology, regardless of how we get that technology. The capability does exist, but it does not exist in silo. We need the global community to support and look at Africa unique, not only from a donation perspective, but from a partnering perspective. And African countries also need to come to the party in terms of looking at where the market is. Going back to my point that this is a business, we need to find a model that will make sure that the African vaccine manufacturing capacity is kept alive. Yes. Okay, and we need to have a market that is sustainable, that is supportive. If African countries would then expect us the lowest prices out of African manufacturers and going back to the norm, then we won't be able to survive. And therefore, my plea, to Europe and to Africa equally, is that we come up with a new order, but the capability exists. Many companies like ourselves have demonstrated that we can partner with the best. We have mRNA technology through the hub that Marie-Paul has described. We've partnered with Pfizer in terms of the fill finish. The capability does exist. Over to you.
Thank you very much. You gave us, both optimism about the future, but also warnings that we need to keep the attention and the focus because it requires sustained investment. Let me invite Sirka Putting to come in because BioNTech is a company that ripped up the rule book. It was a small company that had identified this potential for the new RNA vaccine and has very quickly had to scale up and is now involved in other parts of the world. So what can you share with us about the practical realities of quickly building up capacity in processes that had never been done before because it's a new technology and we know is going to be a key platform for the future? What would you like to share with us?
Yeah, first of all, thank you for inviting me here in this very exciting forum, actually, and discussing these right questions, actually. So first of all, I think as a vaccine manufacturer, there are two things that we need to do because we did scale up with our partner Pfizer very quickly to 3 billion doses produced and delivered last year. and more than 4 billion this year. So this is one key requirement to do this as quickly as possible, because we have these big efficient hubs now for mRNA that we need to use and distribute this over the world. So, and of course we agree that this needs to be going to a substantial amount to low and middle income countries. So last year we delivered 1 billion doses to low and middle income countries. Another billion will follow until the middle of the year. Very important. But this is, of course, not the end of it, because we definitely see and agree the need for local manufacturing, because we see the constraints, we see embargoes, export restrictions and stuff like that. So that's why we fully agree to local manufacturing. And as Marie-Paul said, it shouldn't only be for COVID, because at some point this might go away or wane. It should be also for new vaccines like malaria, TB, and stuff like that. So for malaria, as a side note, I mean, we started the malaria program with BioNTech, because now we have this vaccine development expertise and we have a technology that might help. So we are trying this. But we had in mind like bringing mRNA technology to Africa. And that's why we initiated this localization of production. First steps are a learning from the pandemic scale up is do everything in parallel, because if you do it sequentially, it takes way too long. So that's why we partnered together with Pfizer, we partnered with Morena and the BioVac Institute for fill and finish. This is a part which is like independent of what we do then. This takes already time because of the minus 70 degrees where you have to freeze it. I mean, it's the shelf life is extended now. You can have it a month at fridge temperature, but after filling and finish for long-term storage, you need it at minus 70 degrees, and that's already complicated for the fill and finish process. So while we are tech transferring this fill and finish process to South Africa, we are developing concepts for local manufacturing, and we have a couple of countries which we're talking to and where we all want to build local manufacturing. This is Senegal, this is Rwanda, and South Africa. And we plan to start the construction of this in Q2 of this year. So this would then be the first hub or node in a decentralized and robust African end-to-end manufacturing network. So this is how we're going to do it, like everything at the same time. While transferring it, we are building and developing these like local manufacturing units that can be deployed quickly in Africa and come up running as quickly as possible. And the tech transfer needs know-how transfer, as we said before. So we transferred the technology and equipment, everything to Africa to deploy quickly, but we also need to train the local forces, the local workforces, and that's why we want to partner up very closely with the WHO vaccine hubs and also come up with training concepts most efficiently that really local workforce can actually do the mRNA process. So yes, so in that sense, we are fully committed to supplying the vaccine to people around the world and fully committed to bring the mRNA technology to Africa.
Thank you. And in fact, we had a comment in the chat from Mansour Ahmed who said that, we won't get a flourishing, high-tech medical supplies and vaccine manufacturing in Africa if we limit to just fill and finish. So you've spoken there, Ms. Putting, about the importance of building local capacity for this new RNA platform. And I wonder if you could just give me a last message about how you see the future of the bio-life sciences in Africa, because we spoke at the beginning that there is a huge population, there's a huge demand. 25% of the global vaccine demand is in Africa, but there is very little in terms of the life science cluster, the advanced research capacity, and manufacturing. The point we're trying to make in this conversation is now is the time to invest in it. I wonder if you want to just make a comment on that. Silke?
Yeah, I was muted, sorry. So I think it takes a couple of things to really make this flourish. So we saw that, for example, with Morena's BioVac Institute, with the Institut Pasteur de Dakar, with Rwanda, there are emerging biotech hubs. Yeah? So I think the technology is there, the research personnel is there. I think it needs a spark now really to do this. That's why we bring technology that's complementary to what's there already. And as I said, we want to team with the local partners to teach them how to do this complex mRNA technology. The skills will be there, and it will take intelligent schemes how to really teach and how to do it most efficiently, ideally while also training on the job and while running the production and so on. But with the research and development capabilities that are there already, plus the new technology for manufacturing, I think this will probably spark, and hopefully spark, a biotech, a wave, a new age of life sciences. And I guess because mRNA especially has a very small footprint, it's not these huge biofactories, it can be fairly small. You can probably create ecosystems around this that live off, for example, mRNA, but then also other biotech technologies that come to Africa.
Thank you very much. Let me now bring in Abebe Emro Selassie from the IMF, because we heard there a call to say, please don't let this be a short-term attention span of international funders. This should be kickstarting a sustained investment in full spectrum ecosystem of manufacturing and high-tech research and development in Africa, not just fill and finish, not just the emergency. What's the IMF's view? What are you doing to make this kind of long-term investment?
Thank you for having us on this panel. And, perhaps as an economist, maybe those are the areas that I can weigh in on rather than directly on the issues of, what kind of technology, et cetera, should be chosen. And I want to make 3 points. I think a lot has been said. First, I think, the economic case for it's not just a political, but really the deep economic case for having very strong vaccine manufacturing capacity is just a no-brainer, and has to be pursued. I think what we've seen last year in particular was huge supply constraints. Having more diversified supply sides, more capacity, I think would have made a lot more sense from way back. But having that on the ground in Africa, where there is such strong need, is just a no-brainer. And also in a forward-looking way, given the demographic trends that we see from the region, given the really very strong pressing needs that there will be to improve human capital in the region. I think it's a no-brainer to have much more investment in these areas. Second, I suspect it's not just investment in production capacity, but quite a bit of work that has to be done. Again, these are points that have been touched on, but quite a lot of work that's going to have to be done to make sure that this production capacity, the vaccines, the medication that's produced, that there is some kind of off-take agreement, not just locally, but internationally. So quite a bit of thinking is going to have to take place to make this sustainable, to make it durable, so that this capacity, when it's needed most in future pandemics, et cetera, can be ramped up. So thinking also about not just the production now, but over time, how how it can be produced, can be integrated into global supply chains is something I think we're going to have to think about. And then the third point I think I want to stress is it's not just the physical capacity, as again, many of the experts ahead of me have touched on, but also, frankly, whether it's patent, but more open source sharing of technology, of know-how in particular, is going to be really, really very important, particularly in situations of pandemic global emergencies, but even in I think regular case. My understanding of why we've seen life expectancy improve in Africa, in many of our countries, has had to do as much about know-how, transfer of know-how, as medication supply. So the know-how angle, having a lot more open source, open sharing of know-how, I think will be really, really very important. What is the IMF doing? I think, touching on a few things that were discussed earlier, I think we are extremely proud, extremely happy that we have been one of the few places, I think, in this pandemic where there has been a lot more of a multilateral effort. So, I think we've been able to have a very robust financing response to the region, including, of course, last year's largest ever SDR allocation, which has created quite a bit of fiscal space for countries to use as they see fit in terms of addressing these kind of challenges. But this effort needs to be sustained. And I think this is the direct answer to your question that, we've seen how pandemics of this sort can bring economies to their knees, much less our countries, even the most advanced countries. And I think having a lot more resilience, a lot more investment in this area has to be one of the big takeaways for us from this pandemic. If not, I think it was Hegel that said, the one thing we learn from history is that we don't learn from history. If we are so smart, I think maybe time to break that cycle. Thank you so much.
Thank you very much. And just as I'm bringing our conversation to a conclusion, I'm going to invite Martin Seychelles, who is representing the Commissioner who had to leave earlier and is the Deputy Director for in the Department for International Departments of excuse me, it's been a long day, International Partnerships. And Martin, we know each other from a long time before when you were working in DG Sante, so you've got this health and development partnership relationship. Let me just ask, we've heard in this conversation the need for sustained investment, the need for investing in the training and capacity of the health workforce. We've talked about the need to have the research capacity in the universities. We talked about the need for having strong clusters of bio-life sciences. And we talked about the need for both Europe and Africa to be clearer in their direction of travel together. I'm hoping that you're going to be able to take some of these messages and pass them to the Commissioner for the forthcoming Africa-Europe Summit. But let me leave you the final words.
Well, I think, thank you first of all for giving me the floor after such an interesting discussion, which has brought out a lot of the elements. First of all, I think we have to start from the premise that this is a general systemic challenge. It's not a problem just of one vaccine or of indeed for vaccines. Africa imports 99% of all the vaccines it needs and 94% of all the medicines it needs. So there is a systemic challenge there, which African leaders have been quick to recognize and quick to take action on. There is strong leadership there, which we are supporting. And as you rightly said, to be a sustainable response, a long-lasting response, it has to tackle all the obstacles which today are really blocking that business case. Ultimately, it will boil down to building a strong case for increased investment in Africa. So the first step is to look at the obstacles, which at the moment, despite the clear potential that Africa has, it's a growing population, a growing importance in the world, still very much still off the radar of the pharmaceutical and medical device industry. So why is that? There are a number of challenges. First of all, we've identified three big areas of work which we are tackling in parallel. First is the supply issue. And it's about the business case for investment. Clearly, we need to work to support Africa become a more attractive location for investment and realize its full potential. This means investing in, for example, financing, in de-risking of investments, but also in building up human resource capacity, facilitating technology transfer, as you just heard. And also, I would underline the importance of supporting African research, because we know how the pharmaceutical landscape works. It is from research that entrepreneurship flows, and that would be the first part of it. But obviously, this is not and cannot just be an industrial policy. This is not just about building more factories. Producing vaccines then brings up the second issue, which is the demand side. And that also needs to be consolidated. Again, here, Africa has shown a lot of leadership with AVAT, and this has been a very important development. But there's much more to be done there, and particularly to bring out the needs of the African health systems. Which are the technologies, the products that Africa needs the most? And all this, finally, can only work if there is the right enabling environment, which is what we're also working on to support the African CDC, the African Medicines Agency, which is now being established, to make sure that trade barriers can be overcome. And this would also help make Africa more attractive, more predictable. And I'm sure that once that is achieved, the rest will follow. The business case is clear if these obstacles can be overcome.
Great. Thank you very much, Martin. We've had a really exciting debate. It's been really lively, very dynamic. And I'm going to invite Chrysula, who started us at the beginning and gave us some context. You know, you're the co-chair of the strategy groups here at the Africa-Europe Foundation. And in our health strategy group, the issue of vaccines and equity has been a red thread throughout our conversation. And it's clear that many of the areas we identified, the need to look at workforce, the sustained investment, the partnership and better distribution has come out here. Let me pass you the floor to close our debate.
Merci. Je vais parler en français.
I will speak French. First of all, I would like to thank all the participants. As I've said, as a doctor, I had the opportunity to work in Africa as a surgeon for many years. And I think that Mo is absolutely right. He delivered the declaration of Abidjan that was referring to 15% public fundings in the health sector in Africa. And today, if there is a positive lesson, a positive takeaway, is that all people, all citizens have been made aware of the importance of health and the need to invest in the health sector, including in Africa. So we need to take care of the citizens. We need to invest in Africa, and I think Europe is ready for that, has already done it. It is important to support, but for that, and there must be the right infrastructure, the right healthcare systems. There must be manufacturing, there must be regulations. So all this is in the pipeline, is being built, and I think that we can be proud of that. We can congratulate ourselves for that. But then we were saying that we should do like Mo, and I like that because Mo is very provocative, and I will also be a bit provocative as Mo is used to being. When we speak about vaccine hesitancy, well, the issue of former colonies, I don't fully agree with that perception. I think that the hesitancy relates to the culture, to beliefs. So that is what I absolutely wanted to stress. And as to the expiry dates of vaccines, the labs also have their responsibilities into that. They should give a clearer timetable, time schedule, in order for COVAX to be able to organize the distribution with the states. Well, I think that there is a good momentum in place, and I think that following these discussions, we realize that Africa is willing to take care of its citizens. Europe is there to support Africa in that process, and I think that with a new WHO architecture, Africa will play a key role for its own continent first. So I would like to thank you all, and I'm looking forward to the event that will take place in 15 days. So and I hope that that summit will be the opportunity to move ahead on health matters.
Sula, and thank you all the participants, the panelists, for engaging with us. And apologies it ran a little long, but we had so much to talk about. It was so lively. There was a lot of great input in the chat, and we welcome very much many of these contributions, and we look forward to taking them further, particularly through our Debating Africa platform. As you heard, the EU-Africa Union Summit is coming in the next few weeks, and we are proud to be the partners of the Business Forum that will be, as you see on the screen, between the 14th and 18th of February. There'll be a number of specific discussions, including on manufacturing of health and vaccine products. Thank you all for participating, and see you soon. Goodbye.